Hey, good afternoon, Scurry County. It's Dan Hicks, County Judge. I'm here with Dana Hartman with the Health Unit, and we're going to put some information out today. Dan has specifically asked to be here today because there's a lot of information that needs to come out. So thank you for coming, Dana.
Absolutely.
I'll give out the numbers for today: 18 new cases, 7 recoveries, 97 active cases, 385 recovered. We still have 9 deaths and a total of 491 cases. So I'm going to lay this down so it's not covering me. So there's a lot of information and a lot of misinformation that's out there right now. And if we don't stay on top of it, it just, the rumors spread and it just grows. So
It really does.
yeah,
And with the aid of social media, that misinformation has a tendency to get out there a lot quicker than the real information.
sure.
And so that's what we need to do is try to dispel some of those rumors right now.
Yeah. And so, but there's a lot of information that needs to be put out, right? That we could put out.
Right. There definitely is. A lot of it is said, I'm seeing different things posted on social media as far as pockets of infection, deaths, things like that. I'd like to address that, the pockets of infection. For one thing, currently it is everywhere. People are mobile and they don't stay in one place. So even if it was contracted in that one area, that doesn't mean that it's just going to stay right there in that place. The first time someone goes to the grocery store, they go to another store, bank, anything like that, that's community spread.
Yeah.
And so we're seeing families. We are definitely seeing families that have it go through the entire family. But we also have one person in a family that is positive and the
Right.
rest are not.
Okay.
And so, with that being said, it really does, it varies.
Sure.
And currently, as I said, and I've said this a long time ago,
Yeah.
it is really everywhere.
Mhm.
And everyone needs to treat it like it's everywhere right now.
Yeah.
The main thing you can do is protect yourself. Protect yourself by social distancing, wear your mask, wash your hands. And these are the same things that we have said for months now.
Right. Yeah.
I think at night when it's just
Yeah.
that's what rolls around in your head. It's just that over and over. And those are one of the few things that have not changed about this.
Right.
I'll put it that way. They have said from day one
Mhm.
to do that, to follow those guidelines.
Yes.
But if you're not being proactive, don't expect great results. Don't expect not to get sick
Yeah.
if you're not at least trying.
Absolutely. Another aspect that hasn't changed is quarantine. The
Correct.
time has changed. It's gone from 14 days to 10 days. But if you have it, you're quarantined.
Correct.
So that's something else that I wanted to point out, and I keep pointing out is that no matter how sick you get, if you have no symptoms or you have all of the symptoms, um, you're still going to have to quarantine.
Yes.
And that quarantine means staying at home. Doesn't mean you don't get to go to work, but you get to go everywhere else, or you get to do what you want to do. But it means staying at home. Period. You don't go anywhere.
That is correct. And I'm going to actually give you some numbers in a little bit. But with that being said, the information that is really vital right now, we have so many cases in the county. Um, as of noon today, we have 195 cases since September 1st. For a county our size, that is just
Yeah.
unbelievable.
It is.
We are averaging out at Cogdell anywhere between 80 and 100 tests per day.
Wow.
That is a massive amount of testing
It
that's
is.
going on out there right now.
Yeah.
That does not include testing that's being done elsewhere.
Right.
And there again, we still have people that if they get a positive test one place,
Mhm.
they're going to turn around and try to go to another place and another place until they get the desired result.
Right.
And with that being said, our hospital staff, our school nurses, the health department, we are being inundated right now. We really are. With the number of cases that we have, 18 new
Yeah.
today,
Yeah.
just today. I'm asking the public to please be proactive. And what that means is if you are a known contact, if you know someone that is positive, you've been around them 6 feet or closer, 15 minutes or longer, that is considered a prolonged extended contact. Please, at that moment, go ahead and be proactive and quarantine yourself and take yourself out as much as possible. Take yourself out of the loop.
Yeah.
Go ahead, stay home, monitor your symptoms. Do not wait for a phone call from someone to tell you to do this, because we have given these instructions over and over and over again. The hospital, the school nurses, the health department, I can't tell you the number of phone calls that are being, that are being done every day,
Right.
trying to stay up with all of the contact tracing.
Mhm.
But today we have one positive. We have 30 to contact trace on.
Right.
Okay, so with that being said,
18 times 30 is a lot.
exactly. And so we are asking, please be proactive. If you know a student that is positive, if you know of a student's parent, if you know anyone in the community that you have been in close extended contact with recently and they are a known positive, please take care of yourself, take care of our county, and go ahead and stay home and go ahead and self quarantine and self monitor and do the right thing.
Yeah.
Because we have those in the county that are great.
Mhm.
I mean, they're very proactive. They're doing everything they possibly can to try to help. We also have those that, well, yeah, I was around my sister. We had a birthday party and I was only around her for probably about 3 hours and then find out she's positive, but
Right.
but they're still like, well, I didn't think it was that long, or
Right.
we get every kind of story under the sun right now.
Oh, I'm sure.
And that's one thing we do our best to try to do the contact tracing, to do the education,
Right.
to do the follow-ups.
Yeah.
But we are asking for the county's help. We
Yeah.
really and truly are.
Absolutely.
If you do have questions, please call the health department. If we can help in any way, we have our regular phone number. We have an on-call for emergency after hours. The information is there. And the Snyder ISD has done an excellent job of keeping up with case counts and with getting that information out in a timely fashion.
Right. Yeah.
But as I said, we're all inundated right now.
Yeah.
We really are. And with the current outbreak, these are really scary times. And
Absolutely.
one of the other questions that I would like to go ahead and address, just while we're at
Yeah,
it, if it's
absolutely.
okay. From in September 1st through noon today,
Okay.
as I said, 195 new cases in September.
Right.
But what we did a breakdown 10-year spans,
Mhm.
because people have asked, okay, are these our elderly? Are they who? So this is going to be the breakdown for September.
Okay.
So 0 to 10 years of age, we currently in September had 20 cases. 10 to 20 years of age, we had 26 cases. 20 to 30 years of age, 26 cases. 30 to 40 years of age, 32 cases. 40 to 50-year-olds, 19 cases. 50 to 60-year-olds, 20 cases. 60 to 70-year-olds, 20 cases. 70 to 80 years old, 17 cases. 80 to 90 years old, 12 cases. And 90 to 100, we've had 3 cases. So as you can tell by those numbers,
Yes.
it doesn't discriminate.
At all.
It is
Not even a
just,
little bit.
it's literally from 0 to 100.
Yeah.
It really is. The highest number is the 30 to 40-year-olds,
Right.
and they have 32.
Okay.
So and a lot of those are parents
Mhm.
with school-age children,
Right.
and their school's back in session.
Yes.
And so
Yeah.
we have those parents that are interacting more at the school. There's also soccer, football, there's all of these other activities
Absolutely.
going on.
Yeah.
And so you can kind of see where that would come from.
Yeah. Yeah, you
So,
sure can.
that it was really interesting for us to sit down and actually look at this for September to just get a snapshot.
Yeah, that is interesting. So that's a lot of cases, and it's like you said, it's spread throughout the whole range. It's going to be everybody
Mhm.
that's going to get it. So, and it's not just those that might have pre-existing conditions. It's those that are healthy too.
That's
So,
correct.
you know, it's,
And I do, as far as symptoms, of course, it runs the full spectrum now. What we have seen a lot this last week are people that think that it's allergies,
there you go. I was going to bring that up too. Yeah.
runny nose, watery eyes.
Mhm.
As I said, mimics allergy symptoms. They have tested positive.
Yeah.
And so it's really hard to pinpoint those symptoms.
Yeah.
If there is any symptom that is abnormal for you
Mhm.
this time of year, because some people, I have allergies this time of year,
Right.
but if you have an abnormal symptom,
Mhm.
that should be your tip off.
Yeah.
And that's really, instead of being able to just give you this list of symptoms, it's really kind of morphed into, okay, this is something new for me.
Sure.
This is not something that is normal.
Okay.
And so that's really another key factor.
What about those that do have allergies and they do get those symptoms? I mean, how do you know what's the difference?
And that's whenever it is really tough. I mean, it really and truly is. And that's going to be a judgment call.
Mhm.
And for parents, I know it's hard
Yeah.
because if you have an asthmatic,
Right.
if you have a child that suffers from allergies, I would err to the side of caution,
Yes.
especially, if it subsides in 24 hours, that's
Yeah.
one thing.
Yeah.
But, if your child is still, if it's still 2 to 3 days, we're still in it, it's not getting any better,
Mhm.
I think that you probably need to contact your PCP
Yeah.
and basically just see if you can't do a FaceTime with them, do the telemed,
Right.
just to be on the safe side. And then let that doctor make that call. Probably wouldn't hurt for you to go through the drive-through and get
Yeah.
tested.
Okay.
So, and as said, with that being said, I do want to say the hospital has been affected by this. They've been hit hard.
Okay.
They have had cases out there.
Mhm.
They're being as proactive as humanly possible,
Right.
but it's taken staff out.
Yes.
So, as I said, we've all been affected by it. The county's been affected by it, the community, the hospital. Please do not go to the hospital. Please. If call your primary care physician,
Mhm.
call them first. Okay, if you can't get in with them, please call the walk-in.
Mhm.
But do not just show up, and please do not go to the emergency room unless it is an absolute emergency.
Right.
Because we do have we have other things going on, not just COVID.
Yeah.
Yeah, and we really need to reserve that emergency room for people that are extremely ill.
Yes.
That's what it is there for.
Mhm.
If you're extremely ill, by all means, go to the emergency room. If you think it's potentially COVID, please call the emergency room first. The key to all of this is communication.
Right.
And if you don't get an immediate answer
Mhm.
at the walk-in, please call back.
Yeah. They're overrun.
They
They're gonna be on the
are,
phone
they are.
probably.
They are, and I cannot say it enough about all the nurses, about all of the nurses, all of the staff. There again, there is a team that our COVID team works behind the scenes 24 hours a day,
Right.
7 days a week. And you know that.
Yes.
You get texted
Yeah.
all hours of the day,
I do.
not just to
Yeah.
keep you updated.
Yeah.
But there's also the doctors, the
Mhm.
nurses, the labs,
Yeah.
and as to the school nurses, this is unprecedented
Sure.
times for them.
Oh yeah, absolutely.
And they are facing things that we've never faced before. And as I've said previously, please just extend a little bit of grace with
Right.
all of this.
Yeah.
And I know how scary it is.
Mhm.
And I know if you have a positive case, it's a scary thing.
Sure, yeah.
But
That goes towards something else, shaming someone because they have COVID.
oh,
It's like
absolutely.
blaming someone for the sun shining or something. You
That
know,
is so true.
sometimes, I know of instances where there are people that wear their mask, they're religious about it, and they have ended up with COVID. They've done everything they possibly can to avoid it, and they still ended up with
That's
it.
right.
So it's not their fault if somebody gets COVID.
It
so-
definitely does not discriminate.
Right.
It does not. And you're right. I know people that have done everything possible, but it's going to take all of us to continue to be proactive and be. We have tried as hard as we can. We cannot save people from themselves.
Right.
If we could, we would. We
Yeah.
can't. It's going to be up to individuals. It's going to be up to parents. It's going to be up to facilities.
Yeah.
It's going to be up to organizations to do the right thing.
Right.
And I just and as hard as it was for the senior citizens, for them not to have their May Day,
Yes.
that was the right thing to do.
Right.
And I know it's tough. I know it's been a struggle, but we're all in this together.
Yeah.
We really are. And it was the right call to make.
I believe it was, and they're going to be closed for the next week. So, that was a tough situation.
That was very tough. That is our highest risk population. And we have had deaths. We have had just this last week, we've had deaths in our elderly population.
Yeah.
And the thought of losing one of our little senior citizens
Yes.
due to an event that we did, it's just.
I agree. Yeah. So, what other information do you have for us? Is there anything else that we need to?
The only thing we do have the two major events that are coming up this weekend,
Yeah.
and Dr. Cooper did ask me to please, on his behalf, to remind everyone, please wear your mask, please social distance, please wash your hands. If you don't feel well, if you have any symptoms at all, please stay home.
Absolutely.
We're not going to break this cycle unless we all follow these rules. And I know people don't like it. I know there are people saying it's not real. It's real. It's extremely real. And it is hitting our county so hard right now.
Absolutely.
And we knew it would with the return of school. We knew.
Yeah.
We were looking at the projections. We knew what we were looking at. School has started. Yes, we're in the middle of an outbreak. So we need to do everything humanly possible to break that cycle.
Absolutely. Yeah. We understand that events are going to happen and people are going to go to places, but you have to do the things that are going to protect you and yourselves, you and your families, and those everybody. You got to protect everybody. Shaking hands is one thing that we stopped doing for a long time, but it's been coming back. I've been seeing it. I'll even admit I've done it myself, begrudgingly, but I've done it, and it's one thing I'm going to stop doing again. So we've got to do those things that are going to protect us. So,
Absolutely.
yeah. Good points. Thank you. Is there anything else that you wanted to discuss?
Not at this time.
Okay.
We're continuing to see the numbers rise.
Yeah.
As I said, Cogdell is doing an immense amount of testing.
Yeah.
And I know that we're seeing counties our size that don't have quite the numbers we do. They don't have, a lot has to do with the testing.
Yes.
And there is an immense amount of testing.
We're doing a lot of testing.
We are doing a lot. Dr. Cooper, I would appreciate him. He does not. He's kind of been portrayed as the bad guy sometimes, as the health department in this. We have been, and he has been extremely proactive, and we appreciate all the hours that he has put in also, because we do a lot of testing. We do a lot of contact tracing. tracing. We do. At some point, and we're probably close to that point, contact tracing is going to be a moot point.
Yes, yeah.
And
More like flu season.
correct, yes,
Yeah.
because we've got flu season coming on.
Mhm.
With the contact tracing, as I said, and as those numbers showed you,
Yeah.
okay, trying to contact trace on all of these cases,
Yeah, that's 600 people a day. roughly.
right?
Yeah.
So it's just it's tough.
Yeah.
And as I said previously, we just need our residents to be responsible for themselves
Yeah.
and do the right thing, and that's what we're asking.
Okay. Sounds good to me. Yeah. I hope that we all are. I have a couple of things that I need to announce. I mentioned a minute ago that the health, not the health, the senior center. The senior center is going to be closed this week, and I hope I'm not getting ahead of Tammy on this. I know she was going to put something out there, but they're going to be closed. There has been a case there. The tax office is going to be closed. They've had a case there. We're seeing it everywhere. So we're doing everything we can to protect the public and protect the other employees as well. So we'll get more information out to you as we have it for both the senior center and the tax office. So with that, thank you, Dan, for coming in
Yes,
and giving us all this information. Sure, appreciate it. And we will talk to you tomorrow. Melody's going to be here tomorrow. We're going to talk about the voting process with drag it out to the car and you can vote from your car. So y'all have a great afternoon and we'll talk to you tomorrow. Keep everybody safe.